Hello, this is Brianna Madiri, and I chose my micro presentation to be about rabies, a neurological disease. So, what is rabies? The rabies virus is an envelope bullet-shaped virus that is a member of the Lysovirus genus and of the Rhabdoviridae family. This virus encodes 5 proteins within its life cycle. These proteins are highlighted in pink on the left. In this diagram, that is the structure of the rabies virus. This is a zoonotic neurotropic virus that causes fatal neurological symptoms in mammals. Dogs are the primary transmitter of rabies to humans. What is different about this virus from most viruses is that rabies spreads to the neurons, attacking the central nervous system. Rabies pathology. Its genome consists of single-stranded RNA containing thousands of nucleotides. The rabies virion contains a glycoprotein coat that tricks nearby motor neurons into letting it inside. And here is the steps of how. First, the virus enters a synaptic terminal, which is responsible for sending information to other neurons. Once inside, the virus sheds its glycoprotein coat, releasing its genome of RNA. RNA then makes copies of itself and of its viral proteins, continuing to replicate as daughter virions. These daughter virions make up the spinal cord, move up the spinal cord through connecting neurons. As the virus moves from neuron to neuron, it finally reaches its destination, the brain. And the image on the left is showing all of those steps. And there is a test to detect if someone has rabies, and that test is a fluorescent antibody test, and it is a gold standard test to confirm for rabies. This test detects the presence of rabies antigen negrobodies by a skin biopsy from the nape of the neck. These negrobodies are clumps of viral material formed inside infected neurons, and they are found inside the cytoplasm of brain cells, and they are the main indicators for rabies diagnosis. The image on the right bottom is a microscopic view of the negrobodies. So, how is this virus contracted? Rabies is transmitted through bites, scratches, or licks of broken skin of mucous membranes from the infected animal. Once bitten, the rabies virus enters the peripheral nervous system, where it then infects neurons. The virus moves from neuron to neuron along the spinal cord, which then goes up to the central nervous system and then the salivary glands, and then repeats its cycle. Incubation period is the first stage of infection, showing as no symptoms, usually lasting 1 to 3 months. The second stage of infection is the prodromal stage, where initial symptoms are present, and this stage lasts 2 to 10 days. And the last stage of infection is the neurological stage, which is characterized by extreme emotions and behavioral disturbances, duration of 2 to 7 days. So the first incubation period is symptomless, usually lasting 1 to 3 months, but can be as short as a few days or as long as a few years. Length of the stage can depend on the site of the bite, as if you were bitten closer to the brain, the shorter the incubation period. Also, the length can depend on the patient's immune response and the amount of virus received. The reason this virus has such a long symptomless incubation period is because the virus regulates its production of daughter cells when replicating, refraining from causing so much damage that would alert the immune system. Second stage, prodromal. And this is where the initial symptoms are present. The symptoms characterize themselves by physical and psychological. The physical symptoms include fever, tiredness, headache, burning and tingling at the injured site, loss of appetite, and flu-like symptoms. Initial psychological symptoms include anxiety, irritability, mood swings, depression, insomnia, difficulty concentrating, and restlessness. As before, this lasts 2 to 10 days. And when any of these symptoms start to appear, it means that the virus has made its way to the central nervous system, which is then becoming very fatal to the patient. The last stage is the neurological stage, and this has two forms. There's two clinical forms of rabies. There is the furious rabies and the paralytic rabies. Furious rabies is the more aggressive one and is more common, as 80% of cases is about 80% of the cases. Physical symptoms include hyperactivity, excessive salivation and drooling, muscle spasms, a condition called hydrophobia, which is fear and pain when swallowing, hearing, or seeing water, a condition called aerophobia, which is hypersensitivity to wind or air currents. Psychological symptoms include agitation, hallucinations, delirium, severe anxiety, which can cause panic attacks, paranoia, aggressive and violent behavior, hypersexuality due to limbic system disruption, and fluctuating in consciousness. The second form of rabies is the paralytic rabies, which is less common and not as aggressive. Physical symptoms include muscle weakness, paralysis, usually starting at the site of bite, difficulty swallowing or speaking, respiratory weakness, which can lead to respiratory failure, usually no hydrophobia or aerophobia, and no seizures or dramatic spasms. Psychological symptoms of this includes being withdrawn, depression and flat mood, mild confusion and mental slowing, decreased alertness, rarely any aggression or hallucinations, and the patients appear calm or indifferent despite their progressing illness. Once a patient has reached this stage, the central nervous system is damaged to no return and will eventually experience paralysis and death. Taking precautions and being preventative for this virus is important because its mortality rate is pretty high, almost 100% once symptomatic, meaning the virus has transmitted to the central nervous system. The first rabies vaccine was developed by Louis Pasteur in 1885. Current vaccinations, including pre-exposure and post-exposure prophylaxis, which are an effective prevention of the rabies virus. Pre-exposure would be for people who work as veterinarians, as they would be around animals very often, and post-exposure vaccinations would be someone who is exposed to a rabid animal. Since human rabies is mainly contracted from dog rabies, vaccination of dogs is important for decreasing human rabies. And my references.